being here again. I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So we're here doing gaming for a cause. And again, with Roche-Posay, we're talking about skin cancer. And unfortunately, not a dermatologist. Thanks for being in the chat. Unfortunately, skin cancer is way too rare. It's like, it could be about 1 in 5 people will get it in their life. And again, if you detect it early, it's curable. And your dermatologist is your best friend when it comes to that. So I would definitely say, I'm going to go ahead and cue into a game here and we'll get this rolling. So we'll be playing a little bit of this. Tonight. So it's been good. There's been a nice variety of things today online. All of us are aware of sunscreen. One thing I'll say is, sunscreen is one of the best ways that you can really reduce your risk of skin cancers. So I would just say when it comes to that, there we go. All right, guys. Thank you guys again so much for being here. We're live on all platforms now. Sorry for the delay. So we got this rolling now, but we're going to be playing, obviously playing some games and educating on skin cancer. Again, I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. So any questions that you guys have, feel free to ask them in the chat. It's good to see that I'm not going to be on TT tonight, guys. We're doing it on different platforms tonight. So thanks for asking. This is a really special thing. Roche-Posay, thanks for being here. Thanks for sponsoring the stream. Just kind of getting through a couple little hiccups there. I apologize for that. So as we said, it's a little bit of a learning curve. So yeah. So as you guys might know, dermatologists are experts in hair, skin, and nails, right? So it takes 12 years to become one. And so often of the time, I get people that come in and they're worried about something on their skin. I always tell people, I never want anyone to be, I don't ever want anyone to feel like they're bugging me, right? So if you got something on your skin that you're worried about, it's important to advocate for yourself. No one's ever going to be bothered by going into the doctor, having them look at a spot. And sometimes people come in and the spot's perfectly fine, and that's a good thing. And it can be challenging to kind of detect, what's normal and what's not. But anytime you got something new changing on you, certainly something that is, growing, changing, and we're going to get into things deep, and I'll show you guys exactly what to kind of look for and what to expect. If you see all types of skin cancers, we'll talk about the most common ones like basal cell, squamous cell, and also melanoma, which, everyone's heard about, and that's the quote unquote the bad one. So yeah, we definitely got to look out for those things. So this is very exciting. Thanks again, Roche-Posay, for sponsoring the stream tonight. I saw that they raised a lot of money today for providing skin checks to people that cannot afford them. So it's been an incredible day, and I'm just lucky to be a part of it. So thank you so much. And Alistair, it's good to see you here. Thanks for being here, Alistair. Appreciate you popping on. So we're just getting started here with the game. So very excited about this. We got one here. So that we can kind of think of this guy over here as the UV damage, right? He's the UV damage that's looking at us. So we don't want that. UV damage is one of the most modifiable things that you can do, and avoid for, to prevent skin cancer. So like I said, if you're a gamer and you're inside, you're probably in a little safer bet, but I tell even my patients that have had melanoma, you can't put your life on hold. You got to continue living your life and enjoying, enjoying yourself and going out. You just got to do it in a protected way. So that's so important when it comes to skin cancer prevention. So yeah, we're just getting warmed up here. We're gonna get some skincare myth busting. We're gonna do some polls. So overall, it's gonna be a really good night. We're just getting loaded up here. So thanks for everybody in the stream. And again, if you have questions at all, feel free to ask questions. Photon was saying using Roche-Posay and Thelios religiously thanks to your recommendation. Hopefully I'll never get skin cancer. I certainly hope you never do. And a lot of people will say that, regular use of sunscreen is going to be by far the best thing you can do. It's going to not only help to prevent skin cancers, but also it's going to help with signs of photo aging with time, right? So obviously the most reason to be motivated is to try to avoid, the skin cancers that could potentially hurt you, be destructive, or worse. But also reducing, the typical wrinkles, the dark spots, things like that, whatever motivates you. And sometimes I'll talk to my patients both ways. Exactly. No need for makeup, right? So a lot of times, especially the new tinted sunscreens, I mean, the days of like bad sunscreens are pretty much over, which is the nice part about it. You can find great sunscreens really for any skin type. So I gotta get locked in here on the shots. We got him. All right, so that's what I do to basal cell carcinoma, right? So basal cell, whatever it is, you got to get rid of it. So do we need sunscreen if we're indoors most of the time? So here's what I'll say. For a lot of people, if you are, you are dealing with, a lot of people work office jobs and things of that nature. And it's always a good idea to wear sun protection. Make it a habit, because if you get in that habit every morning, then you're really going to be able to, if you make it a habit every single morning, you're going to get in this routine. And we're not all like UV damage it's not like the burns, right, that get you. Sometimes it's literally the cumulative effect. It's the cumulative effect of that sun exposure over time that really is what gets you, because it's additive. So some of the people I see that have the hardest time are the people that, they have outdoor activities that they do, or they work outside, coming and going from your car, right? Coming and going from your car, you're getting sun exposure through your window glass, and I've done testing of this. Your window glass in your cars even is going to let some of that UV light through. So you got to, look out for all of that stuff. It's going to, you want to protect. If you're putting on sunscreen every single morning and making that a habit, you're going to protect so much better than if you just did, if you just were just like using it, like when you think, quote unquote, I'm going to be outside, or I'm doing outdoor activities. Bulong, thanks for being here. So also, you hear about blue light exposure, and for people that struggle with dark spots, using a tinted sunscreen is going to also help protect from blue light. So like tinted sunscreens, like for example, this is the Roche-Posay tinted sunscreen. Now the cool thing about it is they have all different types of tints now. They have a medium tint, deep tint, so you can find one that matches your skin, and that's going to help protect from blue light too. So obviously you get that from phones, you get it from computer games and screens, but you also mainly get it from UV exposure. So thank you guys so much. Ooh, somebody get me. There we go. So what would you watch for in skin cancer that starts in the nails? So skin cancer that starts in the nails. So usually it's going to show up as a linear streak of the nail. So the biggest thing is, we can smash a toenail or something and you get like you get a blue toenail or something that nature. But if you're seeing dark on the skin close to your nail, that's a major worry, right? If the skin at the base of your nail is starting to turn dark, and then usually with time, it's going to kind of grow out as a line. That's called what we call longitudinal melanonychia. So that's the big fancy name. But basically that is pigment, and your pigment grows from the base of your nail. And unfortunately, these are what we call acral melanomas. This is going to be a little bit more common in some of my black patients, some of my Asian patients. So you got to look out for that stuff, because that not only gets diagnosed later, but also is way more aggressive. So you got to really be careful with that kind of stuff. And anytime you see something on the nail, I'd say go in and get it checked out for sure. So what's the best way to help burn using Nair? So that's a good question. Unfortunately, a little too common, so Nair, obviously this is a little off topic, but it is a hair removal thing that people use. So it's a strong chemical, and you put it on your skin and you can get a burn. So I always like good gentle skincare after that. A nice, just basic petrolatum based ointment would be the way to go, and kind of you do it that way. So again, I thank you guys so much for being here. We're just getting started. Keep the questions coming. I think we're going to actually start some of the myth busting soon, so I'm very excited about that. But I really appreciate. Okay, sounds good. So you can, if you guys want to kick those off, we're going to interact with the chat. I appreciate you. So thanks for being here, guys. So we're going to be looking at some of these questions. So any questions you guys got throughout the chat, feel free to ask them. Again, we're here for you guys. So yeah, so we're going to keep things on topic. I will say the best we can. I will say, somebody was asking about the medicines. It's one of the medicines I use very commonly. I love it. If I'd love to talk mostly tonight about, skin cancer prevention. Certainly if you've had a story, you know, and you want to, you know, share that with our community tonight, I think that's something that's very powerful. If you're comfortable doing it, you feel free to, you know, go ahead and share. So that would be amazing. So again, the biggest reminder tonight is even the scary cancers like melanoma are curable if they're detected early. So, you know, if you catch cancers, what we call stage 0, you know, melanoma can start off as like a, you know, what we call melanoma in situ. It means it's only in the very top layer of the skin and it's not deep at all in the skin, and it's not going to have any chance to spread or hurt you. But as that gets deeper, and deeper is kind of a little bit scary, because when we talk about deeper, we're talking about like a millimeter, and that doesn't sound like very much. You imagine, I mean, I had a patient ask me the other day, they said like, well, how do you determine if you need to, you know, if you need to, you know, test further or whatever? And I said, well, you gotta, you know, it depends on, it's 0.8 of a millimeter. We start talking about it, which is not very deep, right? It's kind of scary to think that, you know, you could potentially have to go into further testing at 0.8 of a millimeter, but that's how important it is to catch it early. And the trouble is, a lot of these skin cancers and stuff, they're not, sometimes they don't really hurt you. They don't really, you know, they're not even hardly bumped up or anything. So they can be very scary. So Photon said, I've had a dysplastic nevus as one consensus cancer, asymmetry, border color evolving. So yeah, and we're going to get deep into some of that stuff because for one, I'm so happy that it wasn't cancer, but I'm happy that you did go in and get it tested when you did, because, you know, theoretically, some of these abnormal moles or dysplastic nevus or atypical nevi, they can turn to cancer down the road. So if you catch them early, once again, it's not a big problem. So it's not a big problem in that way. So that's the beauty of it. You know, it's like you catch this stuff early, you get in, you see your dermatologist. Your dermatologist is your best friend. So yeah. So, and they can definitely help you, you know, never feel embarrassed about it. You know, never feel embarrassed about it. You just go in and get checked. You know, it's way better to get checked and catch stuff early. It's so simple and easy. And again, once again, like Ninja today was kind of talking about his experience at the dermatologist's office and how easy it is. And I'd like to talk to you guys tonight more about, like, you know, skin checks, skincare, skin biopsies and things of this nature too, you know. When in doubt, get it checked out. Absolutely. Absolutely. And then Dirty Dog says, my dermatologist is literally my best friend. That is awesome. I mean, I'm glad you always got to find somebody you jive with, and everyone's got a different personality, but I will say your dermatologist, regardless of their attitude, is the most experienced and best person to help check your skin. Obviously, people in healthcare, throughout healthcare, can help. And then we can start, yeah, we can start running some of those if you want. Paul. Yep. Yeah. No. So yeah. It's fine. So what we're gonna do is we're gonna start some of the skincare, like, kind of myth busting. So you're gonna see them pop up in the chat. Feel free to, like, you know, just answer those questions. What you think? Are they myth? Are they fact? And we're gonna talk through them together. So just feel free. You'll start noticing them come in the chat now. And you can keep the questions coming too, but we'll kind of do that. And Photon says, you know, honestly, the derms on social media make getting skin checks way less terrifying. I think so. And honestly, I am of the belief that dermatologists and social media and a lot of the people that love skincare, obviously there's so many people that love skincare that are online. I think honestly, cancer rates, in my opinion, are going to decrease because I think we got the word out more than ever on how important skin checks are, wearing sunscreen is. I think that is so key. You know what I mean? So keep the questions coming. Anything you got, feel free to ask it. Let me know when you pop that up, mod. Okay, cool. Oh, okay. Oh, nice. Oh yeah, I see the poll at the top. So yeah, the poll is UVB rays, and I'm gonna have to move this box just a touch so I can read the whole thing. Yeah, UV rays cause aging. So do you guys think UVB rays cause aging? And you can vote in the poll. Just feel free to vote in the poll. I think it's going to run for just another, 10-15 seconds, and then we got lots more polls. So you guys, obviously you always learn a lot when you're in the skincare chat, so you'll learn a ton. We got a lot of these we're going to run. We could probably do them in a minute, I would say. So there we go. Oh wow, so this is interesting. So you guys thought, like, so UVB rays cause aging, and it was half and half, 50-50. So this is actually makes for a good one to this is actually a good one to chat about. So It's kind of a tricky question, because I would think, you know, one thing you could easily remember is UVA for aging, right? Now, I'm still going to give credit to a degree to the people that said true, because there's definitely overlap, right? UVB rays are a shorter wavelength. They don't go as deeply in the skin. They're really bad about burning you. So UVB rays you want to think about as burning rays. And actually, this is what most sunscreens are actually, you know, they both protect against UVA and UVB if you got a good one. But most sunscreens are rated on their UVB protection because they want to prevent burn, right? And that's what you see. And that's actually, if you didn't know, how like SPF is basically measured. So that's super key on that. So UVA rays are the predominant rays of aging, and UVB rays are the predominant rays of burning. So that's good. We were 50-50 on that one. Make sure to keep, you know, interacting in the polls. I think if you do that, it'll be a fun chat. We'll learn more together. So yeah, that's a good one. We'll have more coming up for you guys too. So let's keep them going. So Photon said, I really hope so. I was a victim of gym tan and laundry. Right. That I was also a culprit of, you know, for me personally, I was a tanning bed user for literally years, and there's probably nothing I regret more than that. But you know what? We can't control what happened. We just got to look to the future and use better sun protective behaviors going forward, right? You know, you can't control everything you do when you're younger and maybe making bad decisions. You don't realize the risk. So I was a tanning bed user myself, and unfortunately, tanning beds, you know, it's like being in tropical sun. I mean, it is literally a combination of both UVA and UVB rays, like this far from your skin. So I definitely would be careful on that. So I wouldn't tan. I tell patients it's the worst thing literally you can do for your skin. So I definitely would be very, you know, careful on that front. You do not want to use a tanning bed. Avoid that like the plague. Certainly if you've got any kind of, especially history of skin cancers, you got to stop. And I know tanning sometimes can feel good, and I know when it's you know, I know when it's cold out and, you know, it's dark out, and we're gonna get there soon, it's not a good idea. So we got good questions here coming in the chat. Let's see what I got. We got Guy on us here though. We gotta take care of this. Hopefully I have no shields. I have no sunscreen on, guys. I got caught up. No sunscreen. This is bad. Oh, he's got a... So do we need to really apply reapply? So you do want to reapply sunscreen. You want to reapply sunscreen every 2 hours, and no sunscreen is going to work permanently forever. So you definitely want to reapply sunscreen every 2 hours. And then it's a different way. Some like organic or chemical based sunscreens, they kind of like, in a way, you can kind of think of them as they almost like burn up in a way. So as they're hitting your skin, the sun is kind of eliminating those sunscreens, and you got to reapply it. Mineral sunscreens, they kind of clump on our skin over time. So they're like clumping on our skin over time, like on a microscopic level. So you're losing that perfect fresh shield potion, as I just guzzled down there. So you're kind of losing that as time goes on. So you definitely want to you definitely want to like, yeah, reapply. And again, I don't want people to be overly stressed, but like, even if I go to work, I'm going to put sunscreen on my face when I go to work. And then I'm going to go ahead and I'm going to reapply. Like if I go and walk and get a coffee over lunch or whatever, I'm going to go ahead and reapply because I know I'm going to be out again. And sometimes it's like, you know, it's good for everything. It doesn't matter if you're recovering from a procedure, if you're just trying to protect your skin, you know, reapplying, if you know you're going to go out in the hot day sun, is a good idea. If you're sitting in the office, I don't think it's like, you know, I don't want people to be obsessed with it. I mean, there comes a point when you don't want to be overly worried, you know, but, you know, I think it's a good idea to, you know, reapply when you can. Thanks for the follows. Thanks for the subscribes. Certainly, if you're willing or able to donate to the cause, you can do that as well. And I believe that we've got links posted for that if you want to. I know there's an incredible amount of money that was raised today. That money, as I understand, is going to people who are not able to afford skin checks. And I think that's such a worthwhile like cause, because not everybody can afford it. Not everybody can get to it. I remember being a kiddo and needing to go to the dentist and just did not have the means to do it, man. Like, it wasn't happening. None of the dentists took, you know, my insurance that I had. So I went a long time without it. Obviously, the same thing happens with our skin and skin checks. And there needs to be more dermatologists. I'll tell you, there's about, what, I don't know, 315 million people or so in the US, maybe 12,000 dermatologists in the US. So we got to get more dermatologists. We got to be able to get more people in for visits. And it's a worthwhile cause to definitely to, like, you know, to raise this money for getting skin checks for folks. Because if you catch skin cancer early, you're more likely to cure it. So we had a poll up just now. The poll was, you get 80% of your UV exposure before the age of 18. Okay. So, and we got 2 votes for false. So everybody said false, and that's actually correct. This was an old statistic. Now, as you know, when we're kids, we're out running around. We're obviously not thinking, we're not worried at all for a second about sun exposure, right? Like, we're out there, we're having fun, we're doing whatever. But you'd get maybe closer to 25% of your sun exposure before the age of 18. So that means that you have your whole life ahead of you to protect your skin, right? So it feels a little bit, it would actually be a little disheartening, right? If that was not very fun. Whoops. So that was a mistake. So it would be a mistake if we got 80% of our sun exposure before the age of 18, because then there's not, you know, you feel like there's not a lot you can do about it. But say we only got 25%. That's actually awesome, because you have a lot of opportunity to protect going forward. So, you know, getting in there and wearing your sunscreen is key. Why is it hard for insurance to cover these medicines for alopecia? So unfortunately, a lot of these new medicines are incredibly expensive when it comes to those. So that's the hard part. The good thing is sunscreen, not terribly expensive, and you can get amazing sunscreens that are affordable these days. So that's the beauty of it. So we'll keep the polls running, guys. We're gonna have a new poll coming up too. So yeah, before the age of 18, you get about 25% of your sun exposure. And again, sun exposure, if you didn't know, it's actually a class 1 carcinogen. So what that actually means is UV exposure is in the same category as cigarettes, and it's in the same category as asbestos, right? So it directly affects skin cancer, right? And then I've got a great question coming in from Lumos. Knox says, what are your thoughts on UV clothing? So sun protective clothing is a game changer. And I'm going to flip back over to gaming here, and I'm going to pull up this picture for you guys. So as you guys might know, you know, clothing is another way to protect yourself from UV light and skin cancer, right? And you're still gonna have areas that are, like, you know, exposed. You're still gonna have areas that are exposed. You're still gonna have areas that you can see that see the sun. So you want to wear the sunscreens in other areas, but sun protective clothing is called UPF, or Universal Protective Factor. Usually it's going to be around SPF 50, but again, SPF, if you look at SPF, you get a ton of protection at 30, and by 50, it is like legendary shield status. So when you see the SPF 50s, when you see like SPF 50s like this, for example, you know, like SPF 50, that is incredible. You get SPF 60 like the Anthelios melted milk, that's SPF 60. You're getting like the best protection you could ever imagine from this kind of stuff. So so UVF clothing, I'm a huge fan of, especially if you're doing like endurance activities outside. You're cycling, you're going to be playing tennis, whatever it may be. You want to reapply your sunscreen, and you don't want to miss the hard to reach areas. So so there was a poll up that said people with darker skin tones can't get skin cancer, right? And you guys said that is false, and that is absolutely correct, right? So I have multiple patients, my Hispanic patients, Asian patients, patients with more melanated skin types, and everybody is possible to get skin cancer. And unfortunately, sometimes skin cancer is genetic, right? So even it's areas where the sun doesn't shine, you know, like we talked earlier about Ninja. He had one on his foot, obviously an area that you're not getting a ton of sun usually. And he was telling his story about how he found it on vacation, I believe it was, in Hawaii when his feet were out. He told a very kind of funny story towards the end of one of his discussions about how he had been to getting a pedicure, actually. And he was getting a pedicure, and somebody commented on it, said, hey, you must be like a world traveler. And he's like, well, you know, I travel a decent amount. And they said they noticed the one on his heel They noticed the one on his heel, and they thought that that was a sign of him traveling a lot. But unfortunately, 2 years after that, it was actually diagnosed as a melanoma. So that's very scary. So yeah, so anybody can get skin cancer. It is possible for anybody to get it. So that's the scary thing about it. And Bob Marley did have skin cancer too. Some of the other great people, you know, we've lost. Jimmy Buffett, unfortunately, had a type of skin cancer that we can talk about just a little bit called Merkel cell. It's not one you maybe ever heard of, but it can get anybody. You know, obviously, Jimmy Buffett was a guy in the sun. That was his whole persona, you know, the beach life and that. But in Merkel cell, unfortunately, it does affect people that are usually lighter skin tones, older. It usually happens head and neck and up. Jack, thanks for being here. What does SPF number mean? So SPF is sun protective factor, and SPF is basically looking at your ability to extend your time in the sun without getting a burn. So that is the key when it comes to SPF. So you know, you'll get, like, if I pull up again the little chart of SPF rating, if you look here, even at small levels of SPF, you actually get very great protection. And as that SPF number goes up, you get more protection, but in kind of a diminishing way. Now, when we have like, you know, when we, the benefits of higher SPFs, like sometimes you can even find like these SPF, like this one's SPF 60, which is incredibly high. This is again in the Anthelios Roche-Posay Melted Milk SPF 60, but they also make like 100, right? And what we found in research is that people actually will, because they don't typically apply enough sunscreen, when you use higher SPF, it's actually a nice benefit, because even if you don't apply enough, you get better protection. So that's very, very key to know. Now, for an adult, just so you guys have an idea, you do want to apply enough sunscreen to cover areas. So if you're looking at areas outside of your bathing suit area, then in that case, if you're doing that, you want about a shot glass amount of that sunscreen. If you're looking at your face and neck, about 2 full finger lengths is what you're going to want to do. So those are going to be the things you want to do. And we'll keep the polls going, just minute polls, and we'll keep talking about that. I'm going to queue in for another one. Thank you again to La Roche-Posay for sponsoring this and getting the education out. I mean, I know there was a headliner of, I don't even know, there's 8 or 9 streamers, obviously as big as Ninja, been able to raise literally, I don't know what it finished up at. Last I looked, I think it was at $170,000 or $190,000 for people to get skin checks who maybe don't have the financial resources to do it. So yeah, so thanks Photon for being in the chat again. I appreciate you guys. Jack, thanks for being here. If you guys have other questions, feel free to ask. Again, blistering. So the question is, blistering sunburns in childhood, does it double your risk of skin cancer? So that's a great question. Information is so needed. Thank you for doing that. Of course. No, I'm here for you guys, and I'm so happy to share. Honestly, I'm, as a dermatologist, incredibly passionate about this topic. This is literally the most important thing. I do a lot in dermatology, obviously take care of all the eczema, psoriasis, and all of that. But one of my favorite things of all time is treating skin cancer. And I would be thrilled if we were able to eliminate skin cancer in the future. Right? Protection is a huge step in the right direction. And we're just going to have to see how it goes. You know, like, obviously you want to protect the best you can. That is key. But I'm hoping for better treatments, better drug treatments for it, preventing, you know, the best we can. Blood Thinner says, my dermatologist specializes in Mohs surgery. So yeah, so Mohs surgery is a type of treatment. And actually it's the gold standard treatment for, skin cancer. So, that is you know, if you have a dermatologist that is a Mohs surgeon, you're going to have the best expert that can treat skin cancers if you find them. We often use Mohs surgery on the like the common skin cancers like basal cell and squamous cell. Some experts can actually do it for melanoma as well, and they can do that when melanomas and skin cancers are on the face, the ears, the lips, sensitive areas, the hands. You know, when you have skin cancers on ears, lips, hands, the face, those are what we call high risk areas. That means that they're more likely to spread. So it's like anything like that, you gotta, you know, something that's like a wound on the face that's bleeding, that's growing, you gotta definitely watch out for that. So it said, so Arminda said, I haven't gotten a sunburn a little bit ago that felt like the burn lasted 3 weeks and then it was super itchy under the skin for about 6 weeks. Should I be concerned? So I will say, obviously, a lot of people come in the chat and they ask me about burns and what they can do. And it kind of stinks like after you get the burn, because there's not a lot you can do. You can hydrate, that kind of thing, but there's very little you can do to protect. An itch after a sunburn, I would say overall is fairly common and expected. And obviously, I always encourage people to see a dermatologist in person. I think that's really key, to always see a dermatologist in person when you have these concerns with your skin. But any kind of resolving inflammation, which sunburn is very inflammatory and it causes a lot of trouble. So I would just make sure to hydrate that skin really well. Obviously protect if you're going to be out in the sun. And you'll see, you can get a lot more moles and a lot more sunspots when you do get a sunburn. So blistering sunburns actually, as to answer the poll, they actually do increase your risk of skin cancer quite drastically, along with doing any kind of tanning exposures, things like that. Another thing is if you have over 50 moles, these are the thing. So can't say the name of the game, but you guys can see it if you guys want to see. It's up on the screen now. But thanks for being here, Jackson Ray. That's my brother here. Dr. Casal, thanks for being here. I appreciate you. He's a wonderful dermatologist on social media. He's also doing great work out here educating on skin cancer and prevention. So I'm sure you guys have seen him before. If you don't follow him, make sure to give him a follow. Photon says, why the holdup on the new filters in the US and formulas? So I think it's tough. I think it's very expensive for companies to develop. There's a lot of pipeline issues for like getting these things approved. Obviously, some of the other countries kind of do feel like they're ahead of us in the way of sun protection. Maybe things that are more elegant or arguably even better protectors. Now, if you do, the sun protection that we have in the US is, if you use it, it's going to work great, right? And as a dermatologist, I want nothing more than for people to just be able to have the access to all the different types of sunscreen that you got. Like I said, now, like, you don't have to settle for like a bad sunscreen. You can literally get great sunscreens today. They have sunscreens like, if you have, for example, maybe you have dry skin, right? So the Anthelios UV Hydra, like, fantastic sunscreen when it comes to dealing with if you're having dry skin. It's SPF 50. I got a lot of friends that have rosacea, they have sensitive skin. If that case, they have UV clear from again, Roche-Posay Anthelios UV clear. This has a little bit of azelaic acid in it, which can help also reduce like the little like some of that rosacea prone skin. It's going to help you on that front. And then when it comes to tint, right, none of these sunscreens don't have to be thick, they don't have to be heavy. You can find ones nowadays that are way better quality. They're way better quality. They're going to sit nicely on your skin. They're going to feel hydrating. So you can find all of those things now, which is wonderful. Yeah, and I was in the storm. My bad. So Presley, thank you so much. He said, I lost my hearing from that blinding, glowing skin. Well, thank you so much. As I always say, it's the good lighting and the sun protection, keeping the skin glowing and healthy. So, yeah, so thank you so much.
Spray moisturizer out.
Yeah, exactly. And then I think I probably got to, let me switch this too, because I had to restart the Go XLR here. 1 second. Alrighty, so yeah, Boo's here. So thank you so much, and Dr. Casal has to agree. Well, thank you guys. You guys are too kind in the chat. Appreciate you guys. What does the azelaic acid and the Hydra do? UV. So yeah, so when we talk about like dark spots, so azelaic acid can kind of like very mildly, it can kind of it kind of mildly help to improve skin kind of tone and blemishes, kind of fade them. So that's kind of the nice aspect of it. It inhibits an enzyme in our skin called tyrosinase, which makes melanoma. Or sorry, makes melanin. My bad. Hopefully not melanoma. So that's kind of what it does. And it can be, some people kind of think it's a little bit like mildly antimicrobial or mildly anti-inflammatory. So for people that get like little bumps of rosacea, and obviously there's a lot of different types of rosacea out there, but for the people that get the little like papular pustular rosacea, that's key. So effectiveness between SPF effectiveness between SPF, I think the question was 70 and 100. So I'll pull that up. So here's our SPF ratings, right? So if you look at that, you can look at it's a tiny marginal increase in protection. So you actually do get more protection with like 100 than you do with 70. But again, it's a marginal like kind of difference. So I would definitely say, if you can wear it as high, there's no harm in wearing a stronger sunscreen, but the minimum that you want to wear is an SPF 30. That's super key, to make sure to wear at least an SPF 30. That's very, very key. And then the LRP melted milk versus the tinted mineral. So as I recall, I believe you're a big tinted mineral fan. And actually for my face, I love the tinted mineral. If you guys haven't seen it, like this is the tinted mineral. So this is the tinted mineral here. So this is going to be like an amazing one because it kind of masks minor imperfections anyway. And then you get that UV protection. And then you also get, you get great protection. It's SPF 50. So you're getting an incredible protection when it comes to that too. So they are both so good. So they're very, very good. So, and I agree. Photon is a big believer in La Roche-Posay sunscreens, and I appreciate you, Photon. So yeah, feel free. You had any other polls there? So a tan, by the way, just to wrap that one up, it is a scream for help from your skin. So a tan is a response to actually damage. And when your cells and stuff see all that sunlight, what they're doing is they are actually, it's increasing melanin to try to protect the skin. But unfortunately, like really, it's a very small amount of protection. So it's, it's a very small amount of protection that you get from a tan. You're talking like an SPF of 4, which is not very high. So you definitely want to make sure that you protect your skin. You don't want to count on a tan. You hear a lot of people talk about, I'm going on vacation, I want to get a base tan. That's not going to be particularly helpful for you. And I wouldn't count on that being the thing that, protects you at all. Wear your sunscreen. Make sure you got a great sunscreen. Get it before you go so you can save some money if you're going on a trip or something. They're gonna stick it to you at the resort or whatever. So make sure you pick it up before you go. Come prepared. So yeah, what are the bad signs for a mole to be checked out? So that's a great question. So, with moles, normal skin can start off into skin cancer, and then also moles can change over time, right? So if you have a mole that's changing over time, what we'll do is we'll talk about a little bit, like I'll go ahead and throw it up on the screen if you guys want. So if we're looking at moles, we can look at what's called the ABCDEs of melanoma, right? So here's the ABCDEs of melanoma, and you'll kind of see the, A is for asymmetry. So that means like one side of the mole does not look like the other. If you split it in half and you fold it in half, like one side's not like the other. So that's always very suspicious, right? B is border regularity. So you can kind of see in those images there, the wavy borders, right? It's not a perfect circle. It's not an oval. The edges are kind of like, maybe it blends into one side. It's not a sharp distinction. That's suspicious. Color. So maybe the mole is not like the other moles in color. Maybe it's darker. Maybe it's got multiple shades of brown in it. Maybe it's got red in it. Maybe it's got blue in it. These are all worrisome things. And then D is for diameter. And diameter means like if you measure the mole, the easiest way to think about it is the end of a pencil eraser, like an old school number 2 pencil, right? If it's bigger than that, you got to watch a little bit more closely. And then you also have to, and then for E, that's evolving. So a mole that's new or changing, that's always very suspicious too. So you got to look out for all of those things. Those can be like, that all those things could be a bad type of mole. So you got to look out for that. And that's the same thing your doctor is going to look for. Your dermatologist is going to look for that. We're going to look for that like literally on your skin. And then we're going to usually magnifying in with that with a dermatoscope, which is a way to look at that closer on the skin and kind of see there. The question was, the FDA requires tanning beds to have warning labels. And that is true, right? We know that these tanning beds cause skin cancer. They cause premature aging. So they definitely require labels on that. And if you ever go to a tanning bed, it feels like, you get lots of warning there. Again, I did it in the past and I regret it, but there's nothing I can do about it now. So, so what's sunscreen to pair with the Mela B3 serum? So you could do, if you wanted, you could do like the UV tone is a really good one. It also has niacinamide in it. So niacinamide is a wonderful ingredient. It helps not only strengthen your skin barrier, it could potentially also help to, fade some of the dark spots over time, help some of those blemishes and stuff. So I like that. For my oily skin friends, some people feel like they get a little bit of benefit from niacinamide from the oily perspective too. So that's a really, really nice one that can be done too. So I like that a lot. So that would be a good one. But honestly, any sunscreen that you're using is going to be beneficial. And then moderator, are you still there? Okay. Do we got, you can keep so do UVA's rays only cause sunburn? And the prediction on that is ended, which I guess I was supposed to be, these are predictions. I realized I should have been popping those, huh? Okay. Okay. I can only start them. Okay. So here's the thing. Sorry guys. So I need to definitely answer those. Sorry. And I don't know if I can only answer them for a little bit. Maybe. Is that true? Does like time out? Okay, my bad. You can let me know when the prediction's ready too. So not a dermatologist. If you have a mole that looks normal, but it itches a lot, is this a sign to monitor? So I definitely think if a mole's itching, that is a red flag for me. I see a lot of melanomas with a little bit of, like a little bit of redness around them too. Sometimes you can see that a mole change in itching. I got one gal and we found a lot of melanomas on her, and she comes in and if it's itching, we sample it. And we found so many on her, unfortunately, with that sign. Now, you can't count on that though, because a lot of times you may not get any kind of sign with that. It may not have that itching, so you can't count on it. But if it is doing it, I would look out. Mela B3 serum is so good. I agree. It is a fantastic serum. La Roche-Posay has a variety of serums. If you guys don't know, like they do have retinol serums. Obviously, the top 3 things I recommend in any skincare routine is going to be vitamin C, sunscreen, and a retinol of some sort. So, they do have great retinol serums too. Like this is the retinol B3 serum, which is a fantastic one. So that's a really good one that you can do. Their serums are very fun. They're very fun. They're effective. So I really like that. And I think that pretty much everybody should be using a good retinol at bedtime just for the anti-aging benefits and that. So skin smoother, less fine lines, and then a lot of these are going to be hydrating as well. So you have to reapply faster with lower SPFs. So the question, that was a good question in chat from Jackson. And with lower SPFs, it doesn't matter if it's low or high, you still need to reapply about every 2 hours, right? And I would say even if you get in and you get wet and you swim or something like that, or you're very sweaty and you stop the activity or you spray off or anything, like definitely reapply it then, right? So you definitely need to reapply it then. So yep. Thank you guys so much. Mela B3 is awesome. I agree. And then the LRP Rosalac, I may be butchering the name of that. Very good. I've got a nurse actually that has a little bit of rosacea, a little bit of redness. So if you have, La Roche-Posay does make some really great rosacea, prone products. Not only we talked about obviously the sunscreen, the UV clear, which is very good when it comes to that kind of stuff. But you also can do. You guys are hostile. I didn't think they would be. Oh, that was actually a regular player. So yeah, thank you guys so much again for being here. Thank you for La Roche-Posay for sponsoring the stream and helping get the education out there about sun exposure. So the prediction, trying to see, choose a prediction outcome. So okay, what's the most deadly form of skin cancer? And that is going to be melanoma. Did people get to answer that one? I think they did. So melanoma is the most deadly form of skin cancer. That's the most common one that we hear about, right? There are some other types, but melanoma is the one you hear about. That's the one that usually is going to look a little bit dark. It could be black, multiple shades of brown, things like that. So your basal cells, squamous cells, things like that, they can be locally destructive. They can cause a lot of trouble, a lot of grief. They can kind of sometimes eat away at your skin in the area. And when you have limited real estate, like in the face, the ears and stuff like that, you don't want those things getting big. But with melanoma, that's one that can spread. And unfortunately, melanoma can spread not only into your lymph nodes, but it can go also through your bloodstream. So it can go through a variety of different areas. So you got to look out for that stuff. What inspired me to go into dermatology? So some of you guys do know my backstory a little bit, but I was a nurse before I was a doctor, and I got my nursing all done through. I got my nursing license through the military. So I actually joined the military when I was 17, and I joined as a combat medic, and I actually did nursing school in the military as well. And then when I got out, I kind of worked in dermatology, which was amazing. I had an incredible mentor and really fell in love with dermatology because you get to do so much, different things throughout the skin, right? You see people young and old. You do procedural dermatology, like curing skin cancer with surgery. You do different cosmetic work. You diagnose skin under the microscope. You diagnose like complex, medical disorders that affect the skin. You can detect sometimes bigger systemic issues when it comes to that too. So that's good. Yeah. So that inspired me. And then I ended up, when I went to medical school, I knew I wanted to go into dermatology. So I kind of knew that right away. And yeah. So let's see. So very good. So thank you so much. I appreciate it, Dr. Casal, and appreciate you guys. So yeah, so for the most common site for melanoma on the body is the back, right? So I think this is probably a good time. I think we should look at, again, as we kind of reach the top of the hour, we should look again at the ABCDEs of melanoma, because this is going to be super important when it comes to mole checks. So when you're looking at mole checks, this is what we're looking for. We're looking for asymmetry, border irregularity, colors, diameter, and evolving. Now, if you got more than one of these things going on, that's going to make it like more important to like actually you go in and see a doctor, call in, say I'm having these things, tell them what you're seeing. The edges are different. Again, asymmetry, one side's not like the other. Border irregularity, the edges are kind of wavy, different. They're not clearly demarcated or even. Color, dark spots, different shades of brown, shades of red and blue in it. Diameter bigger than a pencil eraser, or evolving means a new mole that's changing, or one that's changing color, changing in size, these kind of things. So again, if you go in for a mole check, what's happening there is it's so easy. You go in and sometimes people have fear about this, but when you go in and you go to your doctor, you're going to go in the room, they're going to give you a gown, right? Most of the time, you're going to keep your underwear on. It's not a problem. Obviously, if you're comfortable, that can come off. Your dermatologist is going to come in and you got to think in, we look at literally like maybe 40 people a day, right? So we've seen it all. So you don't have to be nervous. You don't have to be scared about it. I systematically look over your skin. I always look at someone's right arm. I look at your back. I look at your left arm. I look at the front of your legs, the bottom of your feet. I have you stand up. I look at the back of your legs. And then I come up. I look at your scalp, your face, your chest, and your belly. And I do it the same on every single person. And I will say the things that people are worried about when it comes to that, they're worried about body hair. They're worried about body odor. And I can tell you as a dermatologist, we do not care a single bit about any of that. We just want you to be in there. We're glad we're checking your skin. And it's beautiful when we can say, hey, you got perfect, healthy skin. You ain't got a thing to worry about, and you can leave comfortable. Don't worry about any of the other stuff. We're doctors. We're here for you, and we're here to help you kind of, diagnose this stuff early. And that's what matters. The other stuff doesn't matter, and you don't have to be scared about it. Obviously, it's normal to be a little bit nervous, when you're going and doing something like that. I don't want to make any harsh comparisons, but obviously you go to things like you go to the dentist or something like that, you get nervous about that. I think maybe I'm biased. I think the dermatologist is way more chill. I don't think you have to worry a ton about it if you go to you do that. So if we're going to compare to somebody, personally, I mean if I go to the dentist, usually I have a little bit of a nap before they get into me. I don't know, there's something that's peaceful about it. And then I feel like I'm getting waterboarded when the water comes on. So that part I don't like. But now, say a mole check goes quote unquote bad, right? You find one. Now, again, finding a mole is actually a good thing, I would say. The finding mole is a good thing. And what happens if you do find a mole is we might do a biopsy. Now, that sounds terrible, right? We've all heard about biopsies. That sounds scary. That sounds scary. You don't have to be scared about it. It involves just a few things. All we're going to do is we are going to wipe your skin with alcohol. We're going to do a little bit of numbing, and I know the numbing is always the scary part, but what I tell people is as soon as you basically feel the numbing happen, you're numb. So you're going to feel a little tiny poke and a burn. And I kid you not, when I tell people, like, if I'm injecting somebody, sometimes you can nearly almost feel it. Now, maybe I'm hyping myself up a little too much, but seriously, you can sometimes hardly even feel it. It's so, you know, it's a tiny poke and a burn. And then that numbness lasts for 2 or 3 hours. When we do the sample, all you feel is touch. And it's different for every place you go, but a lot of the times, if you go and, get a skin check, maybe it takes a week to get the results. And honestly, sometimes that's hard because then you're sitting there waiting and you're a little anxious. You're waiting for the word on like what it is. And that can be a little stressful at times. So, you know, the hurry up and wait factor, you know, you get into the dermatologist, you go through your skin check, and then you got to wait on the results. So that's the hard part. I am the lidocaine whisperer, I would say. So thank you so much. So I take it from you guys. Dr. Casal, he's a Mohs surgeon actually. So, you know, they've done a lot of research on how to make numbing injections more comfortable. And I try to employ those. I try to listen to music. I try to inject through a pore on your nose, which sounds crazy, right? If you inject, you know, everyone doesn't like those nose pores, but if you inject through the nose pores, that sometimes you can barely even feel it. So, Dr. Casal, so good question here. Person, and we got to run from the storm. We'll run from the storm, and then I'm gonna actually hit this one. So Dr. Casal says, patient presents with a heavy tan and a pink pearly papule on the right nasal ala. That's the piece of the nose right here, guys. And he denies ever using La Roche-Posay sunscreen. Next best step in management. So I think he's talking about this, guys. That's what we're seeing on the skin. So it's a pink pearly papule. And it is, you know, we kind of call the borders raised and rolled. You can kind of see it almost looks like a little bit of a donut. The middle part is, you know, the little part, maybe a little bit of erosion. Maybe it's bled a little bit. That's the most common type of skin cancer right there. That's called a basal cell carcinoma. So if you ever got a wound that's not healing, one that's looking suspicious like that, you need to go in. You know, a lot of guys, what I see is people have some denial about it. They say, well, you know, I thought it was getting better, or I thought it was healing, you know, that kind of thing. If something's not healing over 3 weeks or so, don't trust that it's just going to go away on its own. I think that's one of the biggest concerns they have. But that's what basal cell carcinoma can look like there on the screen. So that's what you got to watch out for. That's basal cell carcinoma. So that's a great question. Actually, beautiful clinical vignette. Dr. Casal, thanks for being here again, and I love it. So could you tell us what a full body exam includes? Could we refuse and have you look at the area concerned instead? I think it helps to know what to expect. So exactly, all we're doing is literally looking over your skin with usually a light and magnifying glass. And we're looking at moles. We're looking at how do certain moles look compared to others on your body, and comparing them to each other, right? We're looking for those red flags, the ABCDEs. We're looking at those. The same things we tell you guys, we're looking for them. The only difference is your dermatologist is going to see, you know, hundreds of thousands of these. So it's very much pattern recognition for us, and we can like really tell the difference between skin cancers and know what needs a biopsy and that. So that's a really, really great question. Can you make pores look smaller? So my personal like tips for that, if you're trying to create the improve pores and the look of pores, the things that help the most is making sure that like your face is clean and your pores are clean. One of my favorites for that, like the Effaclar 2% salicylic acid cleansing gel from La Roche-Posay. That's a great way to cleanse the skin and help keep those pores like kind of like quote unquote empty or cleaned out. I really like that. You can also do La Roche-Posay Effaclar adapalene gel, and that is a wonderful treatment that often is used for acne, but it can decrease the stickiness of skin cells and kind of prevent those pores from getting blocked up. And I think that is a big help too. That's probably some of my best tips for pores, just the good cleansing and using a good, those are truly like a retinoid. So by the way, never flown this. So let's see here. Try this guy out. So are basal cells harmful and can they turn into melanoma? So another great question. So basal cells are harmful in the sense that they are locally destructive, right? So they can they can literally kind of eat away. They can get bigger and they can eat away at your skin, which sounds terrible. When they're on the nose, when they're on the eyelid and stuff, obviously it can be so destructive. If you get them in areas that are a little bit easier to deal with, like the arms, the back, and things like that, you don't want to still let them grow. You still want to address that as quick as you can. But they can definitely be very, very, the bigger they get, the harder they are to treat. So you want to get them early. Now, do they turn into skin cancer? They actually never, sorry, do they turn into melanoma? They never turn into melanoma. They're from like a different lineage, right? So, bad moles, misbehaving moles, they can turn into melanoma. Obviously, normal skin can kind of kick off and turn into melanoma. However, your basal cells are not going to do that. So you don't have to worry as much about the basal cells turning into melanoma, but they still need to be addressed. So. Okay. So there was a poll that we just did talking about which gender has the highest risk of melanoma in the US. And with that, the answer is male, right? So guys, maybe arguably have a little bit more sun exposure. Maybe it's from the, the outdoor work, things like that. But guys are at a little higher risk, but everybody's at risk, right, guys? Guys, girls, otherwise, everyone is at risk when it comes to skin cancer. So nobody's totally safe on that front. Pulls up, hats and clothing protect your skin better than, I believe it would say sunscreen. So let's see, we're kind of outside the circle here. So make sure to answer on the poll. And check that poll out. Make sure to answer while that's up. There we go. And it said false. So yeah, when you do, the hats and clothing are, they're key to preventing skin cancer, and they're something that's an additive benefit to your sun protection. But you're still going to have areas, right? If you're wearing a hat, and a broad brim hat is going to protect your ears and that kind of thing. However, maybe your nose sticks out some, maybe your chin gets some sun, maybe the sides of your neck still get some sun. So you can't really, just count on that to be your complete sun protection. You're still going to want to apply sunscreen on those sun exposed areas. But I am always happy when people wear more sun protective clothing. So Photon asked about polypodium leukotomas. So that actually comes from a fern. And so that is a wonderful thing. And you can see things like, other products that are out there that have this. That is another beautiful adjunct to skin protection. So I do think that taking that can help, and it can reduce sunburn. There's good research on it. But again, I think wearing sun protective clothing, wearing your hats, wearing your long sleeve shirts, covering up if you're out, and you want to wear like breathable pants and stuff to cover your legs. Obviously, it saves you from reapplying your sunscreen in that area. And if you're using a good SPF 50 or so, then you're going to have that's going to be a really nice way to do it. So, yep. Is there a difference between spray SPF and lotion SPF? Is one more protective than the other? So honestly, you can use either one. I will say, I think the learning curve aspect of like a spray, it can go a little bit a little bit squirrely on spray. I would say if you're going to spray it on your skin, one, you don't want to breathe it, and two, you want to make sure that you do rub it in, because it's easy to get like kind of stripes on the skin and not get full protection. But if it says SPF 30 to 50 and maybe it's who knows, maybe it is SPF 30 or SPF 50, it's still going to do good protection. So yeah, you can use either one. I think you got to find your favorite one. The ones I have, a lot of these are lotions. I'm a kind of a big lotion person, but obviously I'll use either one. If you're getting SPF 50, SPF 60, that is going to be the key with it. But it's fairly regulated. When you look at things, when you look at like SPF protection, then as long as you're getting that like a minimum of SPF 30, you're getting great protection overall. So that's super key. So yeah, I think that's very, very key. And whether it's a spray, whether it's a lotion, either one is good. So are there benefits of sunlight? So yeah, a lot of people ask this question and they're worried, they're, worried that one, if they don't get sun exposure, they're going to have like vitamin D deficiency and things like that. And sunscreen doesn't cause vitamin D deficiency, right? And we can easily actually supplement with vitamin D if we need it. So if you're taking vitamin D over the counter, not only is that very, it's incredibly safe, it's also affordable and effective, right? So you don't have to get it from the sun. And my thing is, why would we get our vitamin D from the one thing that actually is a, you know, it actually is a, you know, a class 1 carcinogen? Again, UV exposure is in the same category as smoking, asbestos, right? So, you know, it's not the safest way to get your, it's not the safest way to get your vitamin D. So that, so I think that's good. We went over some really good myths or facts. We talked about mole checks a bit, kind of what to look for and that kind of thing. So again, we're looking for that, we're looking for that, the ABCDs of melanoma. If you're trying to detect it early, if you got anything that looks like this is key. Moles that are irregular, moles that have changing borders, right? The colors are different than the moles that you have, or the colors are, you know, very dark in color, have, you know, odd shades of red, blue, anything like that. Maybe they look like a scar. All that's very suspicious. If they're bigger than of a pencil eraser, or if they're changing, all that's very, very, you know, yeah. So a couple of things, talking about, you know, sun safety and this kind of thing, you know, it's important to know that when people do go out and get sun and things of that nature, you know, there's areas that we tend to miss, right? And if you think to yourself, what areas have you had a bad, annoying sunburn, right? And I would say, I would almost bet you've had one on your scalp and it's itched you and it just feels horrible. It's itchy, it's irritating. You know, you're laying out, you shouldn't maybe be laying out, but you are laying out and you get a burn on the top of your feet, right? Miserable. Hopefully it wasn't the first day of vacation, right? So thank you so much, Hype Train. Appreciate you. Thank you. That's so exciting. Thanks for gifting the subs, guys. Appreciate you. So, so thank you guys so much. So, yeah, I really appreciate the gift of subs in the chat. So, yeah, exactly. So exactly. Research shows that sunscreen doesn't block the absorption of vitamin D from the sun. Most people are not going to get that complete protection, honestly. And the question was, does sunscreen work instantly after you put it on? I will say this, like with sunscreen, you do want to ideally kind of prepare ahead of time, and you want to make sure you're getting that on your skin maybe, you know, 10-15 minutes before you go out. Ideally 15 minutes. Put that out on your put that on your skin before you go out, so that way you're protected when you get there, right? You can go ahead and you can take you can go ahead and you can, you know, get ready and you can enjoy yourself outside, and stay protected. If you're getting out there and you're outside and you get caught up in something, you might end up with a burn. But the key, again, it's key takeaways, stuff to don't miss. Make sure you're applying on your ears. That area gets missed. Under the, you know, under the eyes, kind of close to the eyes, that's an area that sometimes people miss. An unfortunate area you definitely don't want skin cancer. The backs of the hands, they're going to get just as much sun as our face does. Lips, right? You want to definitely protect the lips. That's an area, all high risk areas, all areas that sometimes get neglected when it comes to sun protection. So yeah, you definitely want to, you know, apply that. Yeah. So keep the questions coming. I want to answer your guys' questions, so feel free to ask those in the chat. I'm here for you guys. We had one question that came through, and it says, what should you do if you think you have sun poisoning? So, you know, if it's bad, I mean, sun poisoning can be really rough, right? And that's after you get, like, you know, a big sunburn or something like that. You're getting major inflammation throughout your body. And sometimes you can even get almost like fevers, chills, and that. You can take a little bit of like Motrin, like NSAIDs, like Motrin, ibuprofen, naproxen. Sometimes that can help. Obviously, stay hydrated. Keep your skin nice and cool, and honestly, aloe vera. But the key is you want to try to prevent that before it starts, right? So wear sunscreen, at least SPF 30. I love going SPF 50. Again, SPF 50 is going to be that legendary shield. It's going to be the 2 plates. It's going to be the 3 plates. You're going to be safe and protected if you do that. So I think that's really, really key. So yeah, guys, keep the questions coming. I appreciate you guys all for being here. Thanks again to Roche-Posay for sponsoring this stream. You guys are amazing, and it's an incredible day to raise this much awareness and this much also money for helping people get skin checks that maybe couldn't afford it, right? So thank you so much again for the Hype Train Boolong. Thanks to the moderators and the chat. Thanks for everybody in the chat asking the questions, and I appreciate it. Again, if you guys got people that love They love skincare. They, share the live, right? Share the live with a friend, have them come over, hang out in the chat for a little bit. Again, it's laid back, it's chill. So we really, really appreciate you guys. So feel free to hop on over and, well, hang out. Yeah. So a good question. Someone had asked about, they had asked about retinol, right? So Jackson said, when do you see the benefits from retinol? So this is the Roche-Posay retinol. A lot of skincare is a bit like a marathon, right? It's a bit of a marathon. It's not that you always see the benefits immediately, but I always say look at it at like 6 weeks, 3 months, that kind of thing. You're going to want to kind of look at it in that timeline. And really, when I see people use retinols, like a lot of times people get it when they're really, like young, like maybe they're starting to retinol for acne or something like that, and they just happen to use it for the rest of their life. They have some of the absolute best skin. They literally look a decade younger. When do you usually game live? Subscribe. Thank you so much for the sub. I appreciate Lumos. Usually if I do it, it's usually on the weekends. I don't have an actual streaming schedule up, but I think I will be doing, starting to get a little bit more refined with this and actually get a good streaming schedule up. And then I'll make sure to post it. And I'll make sure you guys know. Make sure you guys tap the notifications and you guys are subscribed so that you guys will know when I go live. And we'll get a good plan going on here. We'll keep helping you guys get your best skin. So thank you so much. Appreciate it. So Photon says, how do the brand there is tacky? Does our skin need to be completely dry before we apply vitamin C to SPF? So I will say skin dryness is super key when it comes to like retinols and things like that, because they can absorb a little bit more readily and they can get a little bit more irritating if you apply them on wet skin. Ideally, you do want skin to be dry, but it doesn't have to be perfect. And I agree. There's a lot of products out there, that are tacky. They don't feel great. That's one of the reasons I love La Roche-Posay, because thank you so much. Got a hype chest. So thank you so much. Level 2 hype. Thank you guys so much. Appreciate it. Let's see here. What if we do open the hype chest? Bam. So we got that. Thank you so much. Yeah, socials in the bio if you guys want. So keep the questions coming, guys. If you guys got questions, I want to answer them for you guys, especially if it's sun related, skin cancer related. I'm here for you guys. There's about, like 70% of the people don't really realize that, that like the difference between UVA and UVB. So UVA, again, if you want to think about it broadly, UVA is really like aging rays, right? So UVA is aging rays, and UVB is more of like those rays that burn your skin. So that's UVA and UVB. Another thing I've found that people don't, someone actually asked earlier and I didn't get to it, but the question was about, is there a safe way to get a tan, right? And I think that was actually a very good question. And really the only safe way to tan or have the appearance of a tan would be sunless tanning, right? So that's going to be your sunless tanning lotions. They basically kind of stain your skin cells, but the things that some people don't realize is that it doesn't provide you any sun protection. So it's, sometimes that seems like kind of silly to me. You think people know that, but there's been research and some people actually don't realize that doesn't protect your skin, So that's one thing to know. So you can do that. You're very welcome. Happy to help. Photon, thank you so much again for being here. Appreciate you guys. So yeah. So again, when we were talking about SPF, and you'll see like a lot of the ones I'm showing you tonight are SPF 50 or plus. When you get like SPF 15, that's blocking like 93% of UV rays. So back in the day, like the American Academy of Dermatology used to recommend SPF 15 because you could get 93% skin protection from that, which is awesome. But and again, like here's like that SPF rating chart. So you get really good protection even from a small amount of SPF, but ideally you want to get to that 30. Look at what you're protecting at 30. You're getting, a 97% protection, which is amazing. So you definitely want to, 50th. So I placed 50th. You don't want to place 50th in the game. Ideally, you want to wear SPF 50. All right. So that's what you want to do. Hey there. Yeah, I'm not on that one tonight. Sorry, Meg. I'm not on that one tonight. I've been live on these platforms, but not that one tonight. So I'm sorry about that. Sorry about the confusion. But thanks for being here now. I appreciate you. So we got the choo-choo. Pop that through. That was from the hype train. So I appreciate it. Again, keep the questions coming. You know, if you use sunscreen like every day, throughout your life, your risk of squamous cell carcinoma actually could be reduced by around 40%, which is huge. There's not a lot we can do to kind of like reduce skin cancer rates that much, and that's pretty amazing. Melanoma, it may even reduce by 50%. So that's super key with that. And I will say another thing, people ask me, they say, oh, I don't use sun protection all the time. And I've had sunscreen sitting around a long time. If you look at sunscreens, like for this one, for example, like this is the Roche-Posay, this is the UV Pro Sport. If you look at this one and you actually, and it might be hard to see on the cam here, but if we turn this around, right at the top of this little crimp, it will actually show if sunscreen is expired or not, right? So you want to look at that. If you've had sunscreen that's sitting around a long time and you're wanting to get the best protection, make sure to look at the little crimp. You can usually find an expiration date on it. Most of them are going to be stamped for like around 2 to 3 years. So make sure that if you're using those sunscreens at home, that they aren't expired. If you guys do have like trouble with some people that tell me their skin gets irritated from sunscreen. If you, or like maybe your kiddos have like more like irritated skin, or you're worried about getting sensitive, what I would suggest is lean towards a mineral sunscreen. So your mineral sunscreens are going to have they're going to have much lower risk, if not a zero risk of allergy. And they're going to be less irritating, right? They're not going to want to irritate the eyes, bother the eyes as much. So I think that's really key when it comes to your sunscreens. You want to find ones that work for you. And again, you don't have to settle for bad sunscreen anymore. You want to use, the best sunscreen for you. And that means maybe it matches the tint of your skin. It feels good on your skin. That's all very, very key. So I would look at that. So yeah, I appreciate you guys for being here again, Dr. Dylan Greeney. Feel free to be here. So thanks for being here. Sorry. So we're going to start another game here. So which type of sunscreen ingredients reflect UV light? So there's a poll up. If you guys want to vote in the poll, which type of ingredient? Is it chemical ingredients that reflect UV light, or is it mineral ingredients? There's always a little bit of nuance when it comes to this stuff. There's always a little bit of different nuance with it. There's always a little bit of different nuance when it comes to this, but this is a good poll, and it's a great question, and especially on the topic of talking chemical mineral sunscreen. Again, both are safe, both are effective, but it's something to know about it. Is there a study on sunburns to % increase the risk of skin cancer? So yes. So blistering sunburns in childhood, for example, can double your risk of skin cancer. So that's a really, really good. Really, really good question. Sunburns dramatically increase your risk of skin cancer. So exactly. So the poll has ended. You guys did awesome. We had 3 voters in the poll, so I appreciate you guys. Mineral ingredients in sunscreen. That's going to be your zinc oxide and titanium dioxide. Those are going to be the things that reflect away harmful UV rays. Where chemical sunscreens, they kind of do things like a little fancy. They actually will chemical sunscreens are actually going to absorb some of that UV light, and they will actually convert the UV light to heat and release it from your body, so it safely kind of decreases that intensity and damage from the UV light, and it converts it to heat and then causes it to just dissipate away from your body, which is pretty amazing, right? That we have the technology to do that, right? So that is very cool. So there's a lot of different sunscreens, and that's how they work. The polls have been great. I agree. We've got some great ones together. We're trying to cover a lot of ground, I appreciate you guys being here. Hopefully, like my lives, we're sticking to skin cancer. We're sticking to that. A lot of times when we have my typical lives, we kind of cover like all topics, right? So, but I think the polls have been very relevant information that literally can save lives. I have no doubt today on Gaming for Cause that we have literally save lives. There's no doubt about it that someone's going to go out, they're going to get their skin checked. They're going to know, you know, what a skin cancers look like. Again, those common skin cancers, basal cell, right? Squamous cell, melanoma. These are what they look like. The basal cell is going to have that like pink. It's going to be a pink lesion. A lot of times it bleeds easily. It has a rolled border, blood vessels in it. It bleeds easily, things like that. Sometimes the squamous cells are going to be a little bit, they're going to be pink. They're going to be indurated, which I know is kind of fancy doctor speak, but it's going to feel like there's kind of more like a bit of substance under the skin, right? It's going to have like a little bit of it feels like there's something kind of growing under the skin. Now they can start off kind of thin, but usually with time, they're going to become more of a bump. And then your melanomas, a lot of the times, as you see there, they're dark. They're dark. They have irregular borders. They're bigger than of a pencil eraser, but sometimes if you're lucky, you can catch them when they're really small, because if you have a dermatologist take a look at your skin, you're going to be able to diagnose those. Even sometimes I've seen people catch them when they're 2 or 3 millimeters. So that's what basal cell, squamous cell, and melanoma look like. And that's going to be something that is key to look for. So how do you find melanoma? What are the steps for patients? Well, I would say the first thing you do, schedule an appointment with your doctor. If you can get into your family doctor, do that. If you're worried about one, obviously a board certified dermatologist is going to be your best bet. And we're going to look for the ABCDs of melanoma. We're going to look for irregular moles that are asymmetrical on one side or the other. The borders are irregular. The colors are different than the colors of your normal moles, or maybe they're darker in a way. D is for diameter. Maybe they're bigger. So there's something that we call the ugly duckling sign. Like a mole does not look like your other moles. That's always suspicious to us. So, and then evolving means a mole that's new or changing and that kind of thing. A family doctor a family doctor is also like a key part of your team and even diagnosing melanomas. There's plenty of family doctors that find skin cancers and melanomas all the time. And a lot of times then they'll refer to us. If you're a high risk, you should be getting skin checks every single year. And if you've had a melanoma, you need to be getting skin checks every year for the rest of your life. If you, if you have never had a skin check, it's a good idea to go get it looked at. I would say definitely go get it looked at. And definitely say go get it looked at in that. But a family medicine doctor can do it. A dermatologist can do it. Your dermatologist is your best friend, though, when it comes to finding skin cancers and treating skin cancers. It takes 12 years for us to become board certified to do these things. So when you do find a melanoma, what are the next steps for patients? So when you find a melanoma, obviously we got a biopsy, we prove it, right? Once we prove that we know what a melanoma is, what we'll do is we'll get the information on something that's called the Breslow depth. And that means how deep is the melanoma in your skin. So we'll find how deep the melanoma is in the skin. And then that will determine if we need to go investigate further, right? Do we need to, as I reapply my SPF here, 1 second. If melanoma does not have to be deep necessarily to spread. So you do want to get in and get them checked. Once we find out what it is, it will determine if your dermatologist can help it, or if you'll need more surgical help from maybe a surgical oncologist or a surgeon, right? Because sometimes we have to go and check the lymph nodes to make sure we got it all. That can affect your treatments. And the good news is melanoma, we're getting such good treatments that actually we've people are like surviving longer, and we're increasing like the survivability of melanoma by the types of treatments that we're doing for it now, right? And depending on the depth of your melanoma, if they find it, there's new treatments that are available that can harness your immune system to help fight the melanoma. So that's key for it. So yeah. But melanoma in general, it can spread to places. It can spread to anywhere in the skin. It can spread to the brain, to the lungs. It's very scary. So that's why you want to detect it early. If you detect like stage 0 melanoma when it's early in the top level of the skin, in that case, there's not really a chance it's going to spread. And that just means if you've had a melanoma, that you're at a higher risk of getting a melanoma in the future. So because of that, you want to get those skin checks. And when we find someone with melanoma, we'll actually check their skin, sometimes every 3 to 6 months for a couple years, just to stay on top of it. Because in that first couple years after a melanoma diagnosis, you have a higher chance of finding another melanoma. So skin cancer can develop under your nails and on your scalp. And that was a poll that was up. The answer to that is true. Again, we talked a little bit about acral melanoma. So acral melanoma is that one that's on the feet. It's under the nails, right? It's melanoma. It's more dangerous for one. So that's something about it. It is more dangerous, and it can make it harder to detect, because as you can imagine, if you got a mole on the bottom of your foot or under your nail, you may never even think about it. Maybe if you're going in and you're getting, you're getting your nails painted, you're getting a pedicure, maybe they're painting over your nail and it's hiding it. It's out of sight, out of mind. So if you're seeing suspicious things in those areas, that you definitely should go get checked. At what age should we start getting skin checks? So the good news is things like melanoma, basal cell, again, melanoma, like melanoma, basal cell, all these, they're actually pretty uncommon in like kids and teenagers. When you start getting in the 20s and the 30s and things like that, you get to where you can start having skin cancers. And it's not a bad idea to get a check, especially if you have a family history, or if you have a family history, or if you have, a personal history. Obviously, you need to be looking. So that's very key. So again, thank you guys for being here. Feel free to share the stream if you got friends that love skincare and could learn from this too. Effectiveness of mixing vitamin C, retinol, and skin lotion at the same time versus layering them thin to thick. So any type of skincare routine, you want to layer thin to thick. Ideally, I like my vitamin C serums in the morning. La Roche-Posay has a fantastic vitamin C serum. That's great. You can do that. I think theirs is pretty unique because it does have a little bit of salicylic acid in there. So for the people that are a little bit more acne prone, I love that combination of salicylic acid with vitamin C. And when you combine vitamin C with your sunscreen, actually you burn less too. It's obviously not a replacement, but when they've studied vitamin C with sunscreen together, you actually get less post erythema from sun exposure. So thank you guys so much. And then so we do know that, yeah, exactly. The new poll up, you can get cancer on your lips. So do you think that's true or false? Can you get cancer on your lips? If you've been hanging out in the stream, you probably know the answer to that one, but it's a good question. So feel free to drop vote in that poll. If you guys don't mind, vote in the poll. We got up that for another 30 seconds or so. Feel free to get that going. So I will say, from a risk factor standpoint, for the people that are, wondering about who's at highest risk for skin cancers and that, if you're fair skinned, obviously you're an athlete, maybe you do a lot of outdoor tennis, golf, construction, you're out in the sun, farmers, I see a lot, fair skinned, lighter colored eyes. These are going to be the folks at the highest risk of it, right? But anybody can get it. So they dupe me 16. All right, they dupe me. So I'm trying to answer lots of questions and give you guys lots of information. So a little distracted, but it's okay. It's about the education. You know what I mean? So Cassandra Braxton said you can't use face SPF on your lips. Is that true? Well, I would say you can use it there, but is it going to really stick around, right? And this goes perfectly with our poll. You can get skin cancer on your lips, so you do want to be a little bit careful on that front. I will say they make it in more elegant forms, right? Using a sun protective lip balm is probably going to stick to your lips better. It's going to work probably a little bit more effectively because it stays there. Some of the things for the skin and things like that, they're going to be a little lighter weight. They may not stay on your lips as much. Personally, if I was in a pinch, I would be using it on the lips, if I, and I do that. That's just me. Not necessarily saying you do it, but I personally do it. But using it like an SPF lip balm would probably be your better way to do it. That would be the good way to do it overall. So talk about the sun exposure in the car from the window and the roof. My dad had to get part of his ear cut off from driving and sun exposure. So that's totally true. And actually, I did a video on this where I went through and I had a UV meter and I went through and I checked the UV exposure inside the cars, right? So I looked inside the car and I had that there bright peak sun. And actually my car protected from about 99% of UV light. However, my wife's car let about 30% of UV light through there, and UVA is notorious. That's their aging rays, but UVA is also more implicated in causing skin cancer. So that penetrates window glass too. So you do have to be careful. And that's why I say you don't want to think about sunscreen as using it when you don't want to think about it only using it when you're going to go do you're going to a baseball game, or you're going fishing or whatever it may be. So you don't want to think about it like that. You want to think about it as an everyday habit, because the majority of skin cancers are caused by cumulative UV exposure. So it's caused by cumulative UV exposure. And so it's that little bit of sun you get walking to the car, going to the mailbox, you're going on a neighborhood walk. That kind of stuff is actually a big part of the problem. And it doesn't feel like it because we don't get burned. We don't get red. We don't get itchy. You don't get blistered. It's just that little bit of exposure that happens over time. So it's very important to sunscreen up in the car. You guys have probably seen the amazing, the amazing kind of comparisons of some of the truck drivers, right, that are driving all the time. We know that male skin cancers happen more commonly on the left side from the window, and that light coming in through the screen. If you've looked at truck driver kind of UV exposure, you've seen people with horrible skin cancers, wrinkles, dark spots, and all of that on the left side of the face compared to the right. It looks like a different person. And it's a very, very powerful testament to how much exposure that we do get when we are in the sun, and we're not protecting ourselves for that like cumulative exposure that we get. So again, best tips are, you can find the perfect, sunscreen for you. It just depends. For some of my like oily skin friends, one thing I'll throw out here, the Anthelios Clear Skin, this is a dry touch sunscreen. So even this is a fantastic La Roche-Posay sunscreen. If you're like my oily skin friend, you don't want something that's going to be tacky. You don't really need like extra hydration. You're just looking for something to, to put on the skin that's going to be wildly effective, at SPF 50. That's super, super key. So you can get skin cancer on the lips too. So you got to look out for that stuff. Yeah. So then someone asked about the water filters. Obviously a little slightly off topic, but I think for some people that have sensitive skin, I think you can do those filters. I think that's a reasonable thing to try. So shout out to La Roche-Posay. I got my water bottle here from the Thermal Spring Center. If you guys didn't know, La Roche-Posay literally makes all of their products pretty much with thermal spring water that they literally harvest from La Roche-Posay, France. And it has a antioxidant kind of mineral profile in it that has shown benefits to the skin through research. So meaning like sometimes like decreased irritation or redness. Shout out to La Roche-Posay again for sponsoring the stream. Really appreciate it. Okay, thank you. How's it sound now? All right. So yeah. So thank you guys so much. How often should we get skin checks every year? So if you have a personal history of skin cancer or melanoma, we're going to check your skin depending on how recent that melanoma was. It might be every 3 months to 4 months. It might be every 6 months or a year, but your dermatologist can help you with that. I would say yearly skin checks. If you don't have any skin cancer at all, sometimes people come in every couple years. If you got a personal history of skin cancer, I strongly suggest that you get a skin check every single year, and exactly. La Roche-Posay, thanks for the post there. La Roche-Posay is a brand that is so amazing because they've collaborated with dermatologists from the get-go. It's such a unique, incredible story of the way that they've kind of used and in France, in fact, the thermal center that they have there, which is literally this whole medical center that helps to treat people with eczema and psoriasis, maybe people recovering from like radiation and skin cancer treatments. And they actually use their thermal spring water to help soothe these people's skin. And I've been there, and I'll tell you, it was an incredibly touching thing to see. They help tons of people. And again, a lot of the aspects of that are the foundation of their skincare products. So I encourage you guys, definitely, click the link, check out La Roche-Posay. They're not just a skincare brand. It goes so much deeper than that. The dermatologists, not only the 90,000 dermatologists throughout the world that kind of like, believe in La Roche-Posay, but the dermatologists also their boots on the ground in France as well, which is now one of the fastest growing brands in the United States, fortunately, over the last few years. They're so passionate about what they do. And so, yeah, thank you, La Roche-Posay, for sponsoring the stream again. This is Gaming for Cause. We're raising awareness for skin cancer, and we're raising awareness for skin cancer and sun protection. And I appreciate all of you guys for being here. It's been an incredible night. Obviously, this has been a dream of mine for a very long time to get to, to live stream, to educate, to game. It's like a lot of my passions all together. You guys have probably hopped on for other streams to learn about skincare. Again, you guys feel free to subscribe, like, follow. I'm here for you guys always. My whole goal is here. I'm here to help you get your best skin. We got three rounds left. Where'd he go? So yeah, great questions, guys. Keep the questions coming. So let's see. I do not have much in the way of ammo. Thank you guys so much. Again, if you guys do feel the feel the desire to support, as I understand, like the money raised is going to help people who do not have the means to get a skin check. And I know early on streams online, there's been lots of money raised. I think last I checked, it was $170,000. Even if it's $1, if you guys feel comfortable and you have the means to support, feel free to tap the link and you could support that through your donation. And again, that's all going to help raise money for skin checks for those who don't have the means to get them. Obviously, not everybody has access to get into a dermatologist or see their doctor to get a skin check, and even $1 will help. So thank you guys so much. Thanks for the love in the chat. Again, if there's any other okay, try to get up to this guy a little closer here. Let's see. So yeah, let's see here. So I think we hit a lot of important things. We know people with darker skin can get skin cancers too. We want to be using SPF 30s or higher. Sunscreen does not block your body from making vitamin D, and you can always supplement it even if it's low. We know that blistering sunburns are, a worry, and you want to avoid those if possible, but still yet, even if you get one, it doesn't mean you're cooked. You can still protect your skin going forward. That's super key. One thing I think I said in passing, but I think is important to kind of understand is that, if you do have more moles, like you have 50 or more moles, with that, you are at a higher risk of one of those misbehaving and turning into maybe an abnormal mole or potentially turning into a melanoma. So I would say you do want to kind of look out for those two. So if you're somebody that is kind of more moley, definitely kind of look out for that. Mouser says, talk about sunscreen application because should women be applying on the neck and chest due to clothing type is different than men's shirts. So I will say women, a lot of the way the clothing and things like that is cut, it's obviously different. A lot of women, sometimes the shirts are cut down a little bit lower, and I'll see a lot of women with sun damage on the neck and the upper chest because of that. So you want to make sure that you're hitting those type of areas too, because if you miss them, that's an area where you can certainly get skin cancer and sun damage. So you definitely want to protect in those areas as well. Now for women, your melanoma is going to be more likely to occur on the legs. So you want to make sure to protect the legs with sunscreen too. Maybe guys, I don't know if the guys wear more pants kind of thing, and women's maybe wear more shorts on, but women get a lot more skin cancers on the legs. So you got to protect that. Everybody's a little bit different. We're all at risk. You want to be applying at least a shot glass amount of sunscreen on your face, neck, and chest and body of the areas that are outside your bathing suit. Shot glass amount. If you're applying it on your face and neck, a couple finger lengths would be enough to do. You can do that a couple finger lengths, and you want to be reapplying that every 2 hours. So I think that's really key, and it's different for everybody as far as depending if you have exposed skin, you want to make sure that's covered up. Obviously, sun protective clothing, as we've talked about, is another great way to protect from the sun. You can do that, and that's a great way if you know you're doing kind of that mindless outdoor activities. You want to make sure to you can wear sun protective clothing, and then your exposed skin, make sure to wear your sunscreen and keep that skin covered. That'd be key. So let's see here. So in the chat, if you guys, ABCDEs of melanoma, what does the E stand for? What does the E stand for in the ABCDEs of melanoma? Drop in the chat. Drop in the chat what the E stands for in that. So what I'll say too, and as we continue to stream here, is, I see people, fortunately, a lot of times with thin melanomas that are nothing, they're not melanomas that are, they're maybe going to spread or hurt them. But I also see the other side of it. I also see the other side of it. A couple of my patients that come to mind are like my patients that are young, like young mothers. Like I literally have a lady, she's, in her 40s. She has 3 children. She was a little bit nervous. She knew she had a spot in her groin area, and she was nervous about getting it checked, and she was nervous about getting it checked. And she kind of maybe had put it off for some time, right? So she put it off for some time, and she finally got it checked. And unfortunately, when she did get it checked, it was a melanoma. And now that's a metastatic melanoma, right? And then so she goes through this process of, getting it removed, getting the imaging, getting the node biopsies, looking at the lymph nodes, and trying to get treatment. So for me, the things we talked about, not being afraid to see your dermatologist, not knowing that they're judging you for whatever it may be. They're not worried about body hair. They're not worried about you've been walking around and your feet are a little bit sweaty or whatever it is. The more important thing is getting in and getting checked, because now she's fighting melanoma and it's advanced stage and it's spread throughout her body. And she's got 3 kiddos, right? And I'm there for her as a dermatologist. She's got a wonderful team of plastic surgeons and oncologists. Everyone's here for her, right? But if we can catch those things early, the cure rate is super high. We can cure melanoma if we catch it early. If you catch melanoma in the earliest stages, it's a breeze. But when you catch it late, it can be disastrous. So your dermatologist is here to watch your skin with you, to answer your questions, to help make sure we catch things that are scary and dangerous. And I think about my patients like that. I think about advocating for yourself, right? Like I had another patient recently. Fortunately, I just went to a cancer fundraiser and I got to sit at her table with her. She's a melanoma survivor, right? I got to sit at a table with her as we raise money for skin cancer with her. And she had come in, she went to see her doctor and kind of said, hey, I got the spot on the arm. The doctor kind of brushed it off and said, hey, not super worried about it. They didn't really do much with it, right? But she come to me and she said, I'm still worried about this. And I think the biggest thing is I want you guys to advocate for yourself. Advocate for yourself, because if you're worried about something and you know your body best, then you're advocating for yourself. You're making sure that you get these spots checked out. If you know if something is changing, it's looking different for you, it's worth bringing that up with your dermatologist and fighting for yourself, right? Advocate, see your dermatologist. And if your dermatologist says it's okay, you can have pretty dang good reassurance it's all right, because we're the experts of the hair, skin, and nails. We're here to help you. And when you get in a sticky situation where maybe you've got a basal cell or a squamous cell or at worst a melanoma, your dermatologist is going to help you treat that. They're going to help cure you and get you through it. They're going to monitor you in the future to make sure that you're staying clear. So that's a couple of patients that for me that come to mind. I'm sure all of us in the, here tonight has, you've probably had a friend or family member. Again, it's way too common. 1 in 5 people get a skin cancer in their life, right? That's so many people. So you got to be so careful when it comes to that stuff and look out for it. It's scary, but your dermatologist is here to help you. And I can't tell you how thankful I am for you guys being here tonight. It's been an incredible night. I appreciate Roche-Posay for sponsoring this stream, and even honestly for the broader context of gaming for a cause, because I think the idea of gaming for a cause is so key, because I don't even know how many people. I mean, I saw for example, Ninja stream earlier today. Earlier in the day, I know he's raised over $170,000 for the cause today. There was 10,000 people concurrent in the stream earlier. I've always said, as a dermatologist, when we're online and we're talking to people, I can see 38, 40 people a day in my clinic. But when I'm online, I can reach literally millions of people. And just today, you look at all the people that were reached to this event, Gaming for Cause, sponsored by Roche-Posay, and it means the world, because I do think there are only 12,000 dermatologists, right? But the world is a lot smaller, and this was a global effort today to get the word out about skin cancer and raise awareness. So I appreciate you guys being here. I mean, it's been an awesome night. Again, it's a dream come true to me, because it's an important cause. It's a valid cause. It's going to save lives, and I'm also getting to do something really fun, and I'm getting to educate in a fun way. So I really, really appreciate you guys. And again, thanks for being here. For those of you Mariah Carey fan and Meowster who said evolving, with the ABCDs of melanoma. That is exactly right. The E in the ABCDEs is evolving. So if you see those ABCDEs, the E is for evolving. So that's right. So yeah. So I'm here for you guys. I appreciate you guys being here. Again, thank you guys so much for hanging out tonight. This has been awesome. If you guys don't follow or subscribe, feel free to follow, subscribe. You can donate if you have the means to do it. Even $1, that's going to go to helping to raise money for people that can't get skin checks. So feel free to do that if you want to. So yeah, thank you guys again. I appreciate everybody hopping on tonight. It's been incredible. Again, if you got friends that love skincare, if they love the skincare education component, share the profile with them. I'm on all platforms. You can find obviously the link in bios. Absolutely happy to help Meowster. I agree. It's the best cause. It's such a great cause and I love doing it. So I'm here for you guys, man. I'm here for you guys that do it all day. You know, I do work as a dermatologist full-time too. So I see, about 160 patients a week. So it's awesome. And then when I get out of there, I come in here and we get on live and we educate on here. So I'm here for you guys. Feel like 24/7, and it's a good thing. I'm blessed to have this position and get to reach so many of you guys. Any other questions, feel free to keep them coming in the chat. Again, I appreciate you guys for being here. Thank you so much. So we got another pull up. Most adults need about a 1 ounce to cover their body to protect their skin. So you guys can vote in that if you guys want to. 1 ounce. So what is an ounce if you think about it? What's that compare to? 30 milliliters for my global friends that are here. So what's my favorite LRP skincare? So I really do love the Anthelios light fluid sunscreen, the tinted version. This is one of my favorite tinted sunscreens for the face. I love this one. And I would say usually if I'm out, I'm using most likely the Anthelios Melted Milk SPF 60. This is my go-to. I'm out, I'm in the sun. Again, with that SPF 60, you're getting such amazing protection. So those are some of my go-tos. If you're looking, a lot of people want something a little bit more simple, right? So the Roche-Posay Toleriane Double Repair, this is a moisturizer that they make that's been a long-time favorite of mine. They also do make this one though as a sunscreen. So you can get this one that's a moisturizer sunscreen combo, which makes that actually very, very nice, So those are all very good, but the tinted mineral sunscreen I really do love a lot. So for skin checks, again, I think if you have a personal history of skin cancer, I would be, doing those skin checks yearly. And the further you get out from a skin cancer, ideally, the more, it's not friendly. This thing's like UV over here. The wildlife over here is like UV exposure, not our friend. So, but as you saw me take him down, it's as simple as wearing sunscreen. Prevent. Protect, prevent. Gaming for cause tonight with the Roche-Posay. It's been a dream come true, man. So I also, one thing we didn't really get into at all tonight, but La Roche-Posay, I feel like is also very much and should be well known for their cleansers and moisturizers. They have some across the line. The one I've been using lately, Toleriane Foaming, this one in particular, if you guys are looking for just a great cleanser that suds up, it's going to remove makeup, it's going to just remove tinted sunscreen. This is one of my favorite cleansers of all time. That's my daily. That's what I use all the time. And then they're, as we get into the winter months, the Toleriane Double Repair is an incredible one, especially for the legs. It's a thick, rich moisturizer that can be incredibly protective. So I definitely think that's a good one too. And I appreciate you guys being here. Make sure to drop the questions. I appreciate the questions, guys. Meowster, drop the questions in the chat. We're here for a little bit longer, so I'd love for you guys to, to ask questions if you got them. as we eradicate skin cancer together. We're going to detect it early. We're going to protect. We're going to get treated. We're going to catch them early. They're easy to treat at that point. We know about UV exposure. We knew UVA and UVB are not helpful, right? Those things cause aging. They cause burns. We're going to protect against that. Drop questions in the chat. We know that a tan is not protective, right? Tan does not protect you from the sun. Don't do that. Don't count on that tan. We don't want blistering. We don't want sunburns. It's going to increase our risk of skin cancer dramatically. We know that nowadays you don't have to settle for bad sunscreen. You can literally get amazing sunscreens across the board. You can get incredible sunscreens across the board that you know, that are going to suit your skin type. You know, like there's so many people I think that are kind of been like a little bit burnt on maybe using us you know, a bad sunscreen in the past, and they kind of feel like all sunscreens have like a white cast, or all sunscreens feel thick and heavy and greasy, and it's just not the case. Nowadays sunscreens can be incredible. Like, if let's take a look, like this is the Anthelios UV Clear, for example, the azelaic acid. So this is like a great sunscreen. We'll put a little of that on. So again, so there's our sunscreen, right? So they do not have to be like the white cast. They go on like a moisturizer these days. They feel great on the skin. They're hydrating. You can find good ones, and you never have to settle for bad sunscreen these days, guys. There's so many good options, and you can find the one that's perfect for you. And it can help you so much. Chemical versus mineral sunscreen are both good, but does one offer more protection? So they both, you can find ones that protect the same amount, and you want to look to the SPF rating for the level of protection against UVB exposure. So you can use it whichever one. I will say, if you have very super sensitive skin, I would lean towards the mineral. If you don't have sensitive skin at all, use the chemical. Some people will feel like the mineral sunscreens sometimes can feel like a little bit more I like tinted ones. Sometimes people feel like they have a little bit more of a cast, where chemical sunscreens generally are going to be a little bit more elegant. But honestly, you can find good ones either way. Chemical sunscreens, like, they basically absorb and partially reflect UV light. Your mineral sunscreens are actually going to reflect UV light, right? And they're made with things like zinc and titanium, and that's how those work. So they work in a little bit different way, but they are both effective, and they're both very good. So yes, so either one, you got to just find the perfect one for you. And sometimes it takes a little bit of experimentation. I encourage people to actually go to their favorite like skincare store and go through and actually sample some of the different sunscreens, and just put them on their hands. Because sometimes if you buy a sunscreen, maybe you're a little disappointed because maybe you get one you didn't like. But if you go through and you try a bunch of different sunscreens, if you tried a bunch of different sunscreens, like in the moment, you can pick the one you like the most, try it on your hand, and then you can walk out with one that you know you're going to love. So I think that's a really great way of doing it if you get the opportunity to sample it. Shelf life of sunscreen, again, that's a really good question. For those of you guys that are looking and you're like kind of wondering, is mine expired? If you look at your sunscreen here and you flip it over and look at the little crimp on the top, this little crimp up at the top usually is going to have the expiration date. Most of the time, from the time you purchase it or the time it's manufactured, they're going to last for about maybe around you know, 2 to 3 years. So you can look at that. Should kids wear mineral sunscreen when they start wearing sunscreens? I love, you can technically, kids can use chemical or mineral sunscreens. We usually start sun protection after age of 6 months for kiddos, but I do love mineral sunscreens for kids. Mineral sunscreens are not absorbed in the skin at all, so I think that's something that's very nice when it comes to mineral-based sunscreens. Is if you have a kiddo, you can use a mineral-based sunscreen. You know, there's no sunscreen, there's no absorption or anything like that into the body, and it all kind of sits on the top of the skin. So I think that's a really, really nice option. So yeah. Oh my gosh, really? Seriously. Wow, no. Dang. I feel like I did so many shots on that guy. That was ridiculous. So yeah, guys, thank you guys so much for being here again. Dr. Dylan Greeney. Any questions you guys have in the chat? Guys, if you guys don't follow me, again, when it comes to skin cancer, right? Early detection is key, guys. This has been a fantastic night gaming for cause with Roche-Posay. educating you guys on skin cancer, what to look for, sun protection, how to protect, what SPF means, what's UVA, what's UVB, what are the most common areas that we miss, right? We talked about it all that night. We talked about it. Don't miss the lips, don't miss the ears. Make sure you're combining your UPF clothing, your sun protective clothing with your sunscreen to get the best effects. The fact that if we catch skin cancer early, we can detect it and we can treat it more effectively. All of that is key. This has been a beautiful day of raising money for skin cancer awareness, and also and also raising education, right? Because the education is the key when it comes to skin cancer. And if you, so very good. So thank you so much, guys. So I really appreciate you guys being here again, all the great questions that you guys had. I'm always here for you guys. I am online all the time. I always tell people, if you guys ask any questions that you got, you could just pop them in the comments. I try to literally get back to every question, so feel free to, you know, ask those questions if you got them. So again, I'm here for you guys. Roche-Posay, again, thank you so much for sponsoring the stream. Roche-Posay is a company that literally makes some of the best skincare. They make an incredible range of whether it be cleansers, moisturizers, sun protection, to help protect your skin and help keep your skin happy and healthy. So I really, it means the world. We love seeing these brands come together, brands that do research for people that are going through cancer treatments, that formulate skincare in a way that dermatologists love, that's gentle on the skin, that's often fragrance free, that's often non-comedogenic. These are the things that we love in skincare. It's the type of skincare that dermatologists recommend for all of their patients. And so when you got a brand that listens and helps to, you know, collaborates with dermatologists to make great skincare that helps keep people's skin happy and healthy, it means the world. You're very welcome, Yvette. You're very welcome, La Roche-Posay. I appreciate you guys. Again, thank you for the opportunity. This has been incredible. I hope we all learned something together. And again, I want you guys all to know that I'm here for you. If you have any questions at all you got to ever do is ask in the comments and try to get back to you guys. I'm hoping that we can do more of this amazing content and spread the word about skin cancer, sun protection, prevention, you know, in the future. I think it's going to be it's a beautiful start to things, and I think we're going to do it together. I appreciate you guys being here. I'm going to load up on the helicopter and fly away into the night. So thank you guys so much. La Roche-Posay. I'm headed out. So here we go. Flying away in the helicopter into the night. So thank you guys so much. Again, I'm here for you guys. Follow, like, subscribe, donate if you wish, if you have the means. I appreciate you guys, and thank you again. And I hope to see all of you guys soon on social. So thank you so much. Appreciate you guys.